Did you know that overweight and obesity together are the number 2 cause of preventable death in the United States? According to the data compiled by the National Health and Nutrition Examination Survey and analyzed by doctors at the CDC and NCHS, which is the National Center for Health Statistics, nearly 36% of American adults and 17% of American children were considered obese. Through my personal life and career as a pharmacy technician, I have seen the effects of escalating obesity both on the physical and mental health of those around me. In my family life, I have watched my grandmother struggle with obesity and obesity-related health problems such as diabetes and limited mobility. In my workplace, I have watched prescriptions multiply as clients gain weight and along with it gained health problems and more medications, indicating that obesity is more than just the cosmetic concern it appears to be. Obesity is a rapidly escalating problem in America that affects multiple body systems in a negative way. Today I'd like to define obesity, make clear the effects it can have on other body systems, and discuss ways to develop a healthy lifestyle in order to lower the risks associated with being overweight and obese. While the definition of overweight and obese is in constant flux, the CDC has loosely defined these terms as labels for weight ranges that are greater than what is considered healthy for any given weight. For adults, these ranges are typically calculated using the body mass index, or BMI. BMI is usually a good indicator of body fat, although it can overestimate body fat for athletes who have more muscle and underestimate body fat for the elderly or anyone who has lost muscle. For methods of determining weight and health, other methods of determining weight and health risks are the measurement of waist circumference, waist to hip ratios, and evaluation of personal risk factors. BMI can be calculated by taking your weight in pounds and dividing it by your height in inches squared and multiplying the result by 703. There are also online calculators available for ease of use. BMI ranges are used to classify weights as underweight, normal, overweight, or obese. An adult with a BMI of between 25 and 29 is considered overweight, and an adult with a BMI above 30 is considered obese. There are several classes of obesity as defined by the National Institute of Health. As a person progresses through these categories, the likelihood and severity of associated health risks also begins to increase. Now that we have defined overweight and obese in terms of BMI, we can begin to explore the health risks associated with having a higher than ideal amount of body fat. Individuals who are overweight and obese are at an increased risk to develop many diseases and conditions. These health conditions can be classified into two categories: those caused by the increased presence of fat tissue alone, and those caused chemically by metabolic secretions from those fat cells. Health conditions associated with increased adipose tissue alone can be mental or physical. Health conditions associated with increased adipose tissue alone can mentally be depression and anxiety due to social stigmas and judgment, and in the severely obese, limited mobility and decrease in functionality may also contribute to mental health concerns. In a 2004 study from the International Journal of Obesity, the conclusions read, obesity was associated with the increased risk for depression across gender and racial groups, even after controlling for chronic physical disease, familial depression, and demographic risk factors. What this means is that an increase in BMI over a certain point was found to be directly related to an increase in obesity regardless of gender, nationality, medical concerns, or family history. Physically, increased body fat contributes to osteoarthritis and joint pain. The increased weight on the weight-bearing joints, such as the knees and hips, can cause these structures to be strained and damaged. Likely, the affected person, due to their discomfort, would then limit activity, including exercise, and the problem would continue to worsen and cause further damage. Another physical problem that is exacerbated by increased body fat is a sleep condition called sleep apnea. Sleep apnea is a condition in which the airway becomes obstructed while sleeping, causing snoring, frequent waking, and in some, a stoppage of breathing altogether. Due to larger tonsils, a larger tongue, and increased neck size in the obese population, the incidence of sleep apnea is increased. While sleeping, the muscles are relaxed, and the extra weight and pressure can prohibit proper function of the airways. Reduction in productive and healthy sleep can also contribute to further weight gain by causing depression, lack of energy, and increased appetite. All of these things can be part of a vicious and worsening cycle. My grandmother is now immobile due to her morbid obesity, which causes a constant decrease in her quality of life, as well as mental state, as you may be able to imagine. She also has many associated health problems we can address in the next section. Now that we have discussed the ways in which increased weight can physically cause problems, we should talk about the ways that the body is chemically affected by the presence of fat cells. Chemical changes in the body due to increased body mass cause health concerns including diabetes, hypertension, gallbladder problems, and an increased risk of cancer, to name a few. In people with high-fat diets and higher body fat percentages, it has been observed that several changes in the body's cells contribute to the increased risk of developing type 2 diabetes and other disorders. One reason for this is that fat cells produce a hormone called resistin. This hormone prevents cells from correctly responding to insulin, which may lead to abnormal blood glucose levels, a change in appetite, and a change in the way your body stores fat. In addition to diabetes, obesity contributes to hypertension. The risk of developing high blood pressure or hypertension is increased by several factors, including poor dietary choices and physical inactivity. These two particularly are likely to be risk factors faced by the overweight and obese. Also, gallstones are a common problem in the obese population. While the cause has not been exactly pinpointed, studies have shown that the prevalence of gallstones, which are deposits of cholesterol, increase when people are over 120% of their ideal body weight. To put this in perspective, a woman that is 5'3", like myself, has an ideal weight range of 104 to 127 pounds. When she reaches 120% of this weight, or 152.4 pounds on the higher end of the ideal range, she'll have a higher likelihood of developing gallstones. Other factors affecting gallstones include diet, family history, and diabetes. Studies have shown that have associated obesity with increased risk of several cancers, including esophageal, pancreatic, colon, and breast cancer. These associated risks are believed to be caused by hormones secreted by fat cells, as well as changes in different body cells due to the increased fat cells. For example, high levels of estrogen are associated with breast, endometrial, and other cancers. Fat tissue produces excess amounts of estrogen in the body, and therefore contributes to increased cancer risk. There are a few ways in which chemical changes in the body due to increased body fat can cause health risks. Now that we've gone over the associated risks of obesity, let's cover some ways to guard against these risks and prevent and discourage obesity. The National Heart, Lung, and Blood Institute recommends good nutrition, physical activity, and monitoring of overall health and wellness as parts of a plan to combat overweight and obesity. Good nutrition is compiled of healthy, balanced meals and portion control. The USDA recommends that in addition to good nutrition, physical activity be a priority in maintaining a healthy lifestyle. The current recommendation minimums for physical activity are 2 hours and 30 minutes a week of moderate aerobic activity, in addition to 2 days of strength training activities for adults. For children, 60 minutes or more a day of moderate activity is recommended and should include climbing, running, and jumping. These are recommended activity minimums in order to gain the health benefits of exercise, such as decreased risk of developing cardiovascular and other disease, decreased risk of depression, and maintaining a strong, healthy body to reduce the risk of injury as well as maintaining a healthy and manageable weight. It's important that you take care of yourself and to keep your regular checkups as well as make appointments regarding any health concerns. Without these appointments, most people will not be aware of things like their blood pressure, heart rate, weight, and any blood work results. Monitoring health can allow for a potential health risk to be caught before it becomes a major problem, and it's easier to take preventative measures to correct or reverse problems such as hypertension and blood glucose levels. Education and awareness are absolutely paramount in creating a healthy lifestyle. Today we've defined obesity, explored the negative health effects it can have on the body, and talked about ways to lead a healthier lifestyle to reduce and prevent health risks. As the number 2 cause of preventable death in the United States, obesity alone is now the cause of over 112,000 deaths per year in the United States. Poor diet, inactivity, and being overweight contribute to hundreds of thousands more. Thank you for listening.